Good evening, good evening, good evening. As usual, yours truly, Dr. Jason Batson, the Senior Medical Director at Batson and Associates. So this would be, I believe it's like about our 12th session like this, and that is the session as it relates to hormonal disruption. Last night, myself and Ms. Ramdan had a very interesting live where we actually spoke on a number of issues. We touched a bit on hormonal imbalance. We also touched a bit on diabetes. We touched a bit on the circulation regeneration, great T, as it relates to helping individuals with problems associated with hypertension. We also had some questions as it relates to hormonal imbalance in women. Last night, someone had spoken to us about pregnancy or miscarriages as it relates to problems associated with conception. So that topic of all touched a bit on, excuse me. Right. That topic itself touched a bit on hormonal disruption. So that's hormonal disruption as it relates to women. So that's what we're going to discuss this evening. A very broad topic, hence why the topic requires so much attention, because this is a weekly program that we do as it relates to hormonal disruption, as I call it, or hormonal imbalance in women. So when we're speaking about hormonal imbalance, what are we speaking about exactly? Okay, so hormones are what? Hormones are chemical messengers in the body. Now, the organ system that is responsible for the production of hormones is what organ system? That is your endocrine system, right? So the endocrine system primarily are the glands. So we have, for example, your thyroid gland. We have your parathyroid. We have your pituitary. We have the adrenals, and so on, right? Now, hormones, as I said, are chemical messengers. So hormones are supposed to be of particular levels in the body. So if you have a hormone that is higher than it's supposed to, will you have a problem? Yes. And if you have a hormone that is supposed to be lower, or that is lower than it is actually supposed to be, would you have a problem? Yes. Remember, the objective or the name of the game as it relates to the human body is what? Equilibrium or balance. So it means that the body is constantly or consistently striving to maintain equilibrium, balance. It is always trying to reestablish balance. So an individual who has a hormonal imbalance challenge, they either have hormones that are too high or hormones that are too low. Simple. That's the simplest explanation I could give you guys as regards to that. So if you have hormones that too high, and I'll give you an example, and you have hormones that too low, how does that affect the body? So I'll tell you. So let's take the thyroid, for example. So the thyroid gland is part, as I mentioned, of the endocrine system. What is the purpose of the thyroid gland? The thyroid gland has multiple purposes, multiple. One of the purpose of the thyroid gland is to maintain calcium levels in the bloodstream, for example. So I'm giving you guys an example here, right? So there is something known as hypothyroidism. What is that? Hypo is the prefix low. So hypothyroid. So it means that the thyroid is functioning at a lower level than it is supposed to be functioning. You all follow me? So if you have hypothyroidism, so the thyroid is functioning lower, and one of the purpose of the thyroid is to control the amount of calcium that leaves the bones and go into the bloodstream, then you could have a situation where you have low levels of blood calcium, right? You all understanding the relationship? It now means, now, let's take it to the other side. So let's say you have hyperthyroidism. Hyperthyroid, the prefix hyper means it's too what? High. So if you have hyperthyroidism now, And we're just using one example of the functions of the thyroid, which is to control blood calcium levels. If the thyroid is functioning too high, what could happen? It could mean that you could end up with too much calcium in the bloodstream. So you all understand why or how essential proper hormonal balance is in the body. That was just two examples, or one example looking at one organ, which is the thyroid, as it relates to if it is too high or if it is too low. So look at the adverse, that condition is known as hypocalcemia or something like that is the name of it. That is when you have too much calcium in your blood. So you all understand why hormonal balance is so important. Last night on the live, somebody mentioned that the doctor told her the reason why she had so many miscarriages, or why she had 2 miscarriages based on what she shared with us last night. And one of the things she said is that the doctor told her that the reason she had the miscarriages was because her progesterone, which is a very important hormone needed for proper pregnancy and proper carrying to term, the doctor told her that the progesterone was too low. So you see, that again is a perfect example why hormonal balance is so important. Because in a case of a woman who is carrying a child, if her hormone levels are not maintained or balanced, she could actually have a miscarriage. So she could lose a child. So you all see how important hormonal balance is in the body. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On YouTube, we are Batson and Associates Trinidad. And this evening, we are discussing hormonal imbalance in the body. We're primarily dealing with females. We're going to touch on the males a bit too as well. So I just shared 2 examples. So hypothyroidism, low thyroid function, could result in low levels of blood calcium. Or hyperthyroidism could result in high blood calcium levels. Because what could happen in an instance like that, when the person has this situation, excuse me 1 minute. Sorry about that. Yeah, when the person has this situation associated with excessive blood calcium levels, it now means that there's a problem, you know? Because if it is we are saying that the blood calcium levels are too high, and the thyroid is responsible for removing calcium from the bones, then it means you could end up in a situation where the bones end up becoming what? Brittle. So that person could actually now end up with osteoporosis. What is osteoporosis? Osteoporosis is when too much calcium exits the bones. Your bones are comprised of calcium, magnesium, and phosphorus in the form of calcium phosphate. Right? Your bones are the warehouses for calcium. So if you have a situation, as I explained there, where you have hyperthyroidism, your thyroid is functioning at a higher level than it's supposed to. So it means the hormones in the body is higher, or the thyroid is functioning at a higher level than it's supposed to. Those are some of the problems that you could end up with in the body. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook, on YouTube. So those are the 2 platforms that we are live on currently. And let me say a pleasant good evening to some of our listeners. Miss Melissa, First Lady Carol, a pleasant good night to you. Mr. Christopher Samuel, sir, he says good night, doctor, and all the listeners. Miss Melissa, says, oh my God, I have hypothyroidism and need help. Well, you need to make an appointment, Melissa. Miss Sharon Hill says, blessed night, Dr. Batson, and everyone, blessed night to you. Miss Joan Lalu says good night. Miss Marge Hill says good night, Dr. Batson, all on the live. And Melissa asked the question again, says, I am going through lots of tests right now for hypothyroidism. I had 2 fainting spells last week. So as I told you, Melissa, I don't know where you're located. I don't know if you're in Trinidad or Tobago, or if you are able to see us. If not, I suggest if you are international, you could actually book an online consultation. You can message us on that telephone number that we have there, 868-314-9975. The numbers are actually below on the screen there. Good. So I just explained to you in simple and the most layman terms that I can explain it in, why you have hypo, or how the differences in the body, or what could take place as it relates to hypothyroidism, low thyroid function, or hyperthyroidism, which is high thyroid function. So you all see simply, and the experience of the young lady. Imagine she had a miscarriage because her progesterone levels were too low. You'll see why it is so important to maintain proper hormonal balance in the body. And I also explained to you a while ago how important it is as well, because look at the situation where you have hyperthyroidism. That person will actually now end up with osteoporosis because too much calcium is leaving the bones. So you all understand the relationship and why homeostasis or balance is so important in the body. And one of the things we do at Batson and Associates, that test, I'm telling you all, do not take that live nutritional blood cell analysis test for granted. It might sound simple, but it is very effective in determining a number of things in the body, especially from the baseline or the foundation levels. Remember, the body functions from what level? From a tissue level? No. From an organ level? No. The body functions from a cellular level. Cells. Cells give you tissues. Tissues give you organs. Organs give you organ systems. And organ systems together give you the entire human body. Simple. Simple, simple, simple. Or you're from New York City. Ma'am, you need, Miss Carol, First Lady, you need to make an appointment. If it means we'll do an online or a Zoom consultation or a WhatsApp consultation for you. We could recommend, we could get your blood tests and have that consultation done. Because I'm telling you, you're going to be in a lot of problems if you don't address that properly. Okay, so all the talks, we're talking, but you need to take action, because delaying on that, you're only making yourself more sick. Okay, my dear? Ms. Latoya James says, good night, everyone. My legs became very weak as soon as my period begins to almost the end. What causes that? Well, one of the issues a lot of women have, anytime you have serious issues with hormonal okay, so if you're a female and every time it's close to a period, all around your period, you experiencing the worst symptomology, weakness in your legs, you have problem with nausea, vomiting, a lot of pain, something is wrong with you. That is the beginning of the pangs of distress. You all ever heard that terminology? Pangs of distress. That is the beginning of the pangs of distress. The human body is designed in such a way that when something is wrong, your body tells you, Most of the time, your body tells you when something is wrong. The issue, a lot of the times, is that we do not listen, or we are incapable of maybe translating what the body is telling us. Yeah. Headaches. If you have a lot of headaches, it is an indication that something is wrong. So, Latoya, that is a sign of hormonal imbalance. Why are your legs weak as soon as your period begins? Do you have a painful period? So the thing is, you have to determine now how you're going to bring about balance in the body. How are we going to bring about balance? Miss Kathleen Ishmael says, night, night, my dear doctor. Thank you for sharing your godly gifts with us. Amen. This is always a beautiful blessing. Blessings, everyone. Thank you for that, Miss Kathleen Ishmael. Miss Keisha Savri says, hi to all. Blessed night. Hi to you. Betty Phillip. Good night, good evening, Dr. Batson, and everyone locked on the live. Miss Rosemary Bishop says, good evening, Dr. Batson. Glad to see you watching from Brooklyn, New York. A pleasant good evening to the persons in Brooklyn, New York. Laurie D. Alexander says, good night, Doc. How does one know they are experiencing hormonal imbalance? There are a number of symptomology. Insomnia is one. And ladies, you must be able to know or have an idea if you're going through menopause. Now, it may be a little problematic if you're a female and you have had consistent hormonal imbalance challenges. Well, then you don't know, because you always had an imbalance. But you must have an idea. as regards to if your hormones always arrive. You must know if you would have gone through menopause. Ladies, not so? Would you say, ladies, it is easy to know if you're going through menopause? You must have an idea. Find out from your mother at what age she went through menopause. If you have older sisters, find out. Usually those things tend to run in family because remember, a female has a menstrual cycle based on the number of eggs that she has in the body. So you need to mind your business. So hormonal imbalance has hundreds of symptoms, hundreds. Weakness in the legs, insomnia, anxiety, depression. And let me tell you something. Anytime you have hormonal imbalance and it reaches the point where it disrupts your central nervous system, you have work to do. And that was one of the things I was explaining last night, because I was telling individuals, I said, let me tell you something. Don't feel when you have a problem with hormonal imbalance. Women, for example, who do hysterectomies, you all know what a hysterectomy is, right? A hysterectomy is the surgical removal of your uterus. There are two types of hysterectomies. You can do a total hysterectomy, which is the surgical removal of your uterus and both your ovaries, or you could do a partial hysterectomy, which is the removal of only the uterus and the doctors leave the ovaries. Either is detrimental and can cause serious central nervous damage, serious central nervous system damage, rather. Do you know that a lot of women, when they do hysterectomies, they end up in the madhouse? You all know that? So it means that if a hysterectomy could bring about immediate symptomology associated with menopause or immediate menopause, imagine what is going on with you when you're going through menopause. So all those symptomology, and that is why women who have serious hormonal imbalances, they usually neurologically and psychologically, they are mental. You can literally go mad, because usually you reach a stage where you are not sleeping. And let me tell you something to ladies. I was talking about yesterday about being sick and understanding you can't be sick since God said let there be light. So you cannot have hormonal imbalance challenges for years and expect Batson and Associates to fix you in a month. It doesn't work so. I do not do work with the Smurfs. I do not work with the Tooth Fairy. I don't work with Mumford from Sesame Street. I don't work with those people. So I'm saying that to say that you have to understand that that problem has serious underlying issues that require proper time to deal with. You might be asking how much time? I would say 3 months to 4 months. You're going to see some significant difference within that space of time. But because the central nervous system is compromised, which is one of the most important organ systems in the body, you are going to be in a lot of problems, a lot. So you have to let the fixing run its course. You have to fix that. Because if you don't fix it properly, you will never get over the problem. Now, you all might think Dr. Batson used the terminology fix as if it is your car or air conditioning unit. And I'm not saying that to be facetious or condescending in any way. I always tell you guys that. But it's a matter of bringing out and helping you to understand the sense of the matter. And if you are an individual who took sleeping tablets to sleep, well, you have more work to do because you mess up your brain chemistry. You all understand what I'm saying to you? Hormonal imbalance is not... Why do you think anyone on this program knows what postpartum depression is? See if you all can answer me. This is an interactive program. So does anyone out there who on the live, who want to send in a message, knows what postpartum depression is? I'll give you guys about a minute to think about it. Look at the telephone numbers there. So keep in mind, if you want to make your appointments, this month we actually have some open clinic days. Keep in mind, Ms. Ramdan was on with me last night. You all heard and saw for yourself how experienced Ms. Ramdan is, how knowledgeable she is. Ms. Ramdan has over 10 years experience, over 12 years experience, in fact, working at Batson Associates. And I have been in practice for just about 15 years. So Ms. Ramdan is very well versed, and she could very well do a consultation concerning anything So that's just to help you to understand the importance of coming and having your blood and your scan done. Dr. Batson does. I do not do blood work. Again, I simply operate from the level of a consultant. So in order for us to expedite you and help you to get your results quickly, you need to follow the system in place. You're coming to do your test. Do not wait to see me. Come and have your test done. The consultant is going to put together some things for you. You're going to start. And if there's anything after that, you would be able to get a review with me, but everybody wouldn't be able to see me. That is impossible. And that is not going to happen. But you need to get your results. It is very, very important that that happens. So to check those telephone numbers out there, keep in mind certain dates. If it is you are looking at the St. James office, then the 27th and the 28th of September are 2 good days to visit that office. The 27th, which is Friday, the 27th of September, and the 28th of September. Shogunas, you could also pay attention. Debe as well has the 27th and the 28th of September. So those of you in the South area, you could actually get your appointments there. Good. So as regards to the question that we asked concerning the postpartum depression, Miss Donna Howell says depression following the birth of a baby. Good. Excellent. Ms. Keisha Savary says, after having a baby, the mother goes through serious depression, sometimes wants to commit suicide, and so forth. Excellent. Good. Now, ladies, I'm sure all of you listening to this program, the majority of you have children. On a proper sane day, would you think of trying to harm your newborn baby? Obviously not. But I'm trying to give you that example to help you to understand how hormonal imbalance is so dangerous that it could take a well-thinking, or what would have been a well-thinking individual, and make them a situation where they could actually think of harming their newborn baby, actually killing that child and killing themselves. So you'll understand how hormonal disruption can seriously interfere with the way you think, with the way that you function. So imagine you cannot sleep. One of your issues with hormonal imbalance, women going through perimenopause and postmenopause. Listen to me, this is not something to play with. That is come back and bite you. You know what it is come back and bite you with? It comes back and bite you with all sorts of neurological and mental problems. You think you just get panic attacks just so? You think it's just so you just get a panic attack? No. There are numerous things that have to be in place in order for you to get a panic attack. So panic attacks, healthy people don't have panic attacks. Don't let any doctor telling you that, they're talking foolishness. If you have panic attacks, you are far from healthy. Your central nervous system, primarily your autonomic nervous system, which controls your sympathetic, parasympathetic nervous system, is out of balance. And if you leave that there, you're going to end up in the madhouse. Plain talk, bad manners. Those are not things to play with. And that is something that Batson and Associates has helped individuals with on numerous occasions. But it is vitally important to have your blood analysis done, the live blood, the dry blood. You could bring any piece of paper you have home there, any MRI, CTs. We're not going to disregard them. But you have to do that blood analysis and that magnetic resonance analysis. I am telling you that. If you don't do that, we will not be dealing with you, because you're not going to come in our office and tell us how to do our jobs. You have to do those tests, because we know exactly what we're looking for in that dry blood analysis. And this is one of the things that Ms. Ramdan was explaining last night when she was talking about, we see something known as Rollo. Rollo is a clear indication of a particular pattern that your blood cells make. And when we see it under a high-powered microscope, we know it is an indication of liver stress. So let's talk a bit about that. So if you have liver stress, you think that's a good thing or a bad thing? Hey guys, answer me. If you have liver stress, and the next question is, how do you know you have liver stress? Answer me. Okay, let me say, right. So we have Miss Felicia James. She says not sure, so I helped to answer that. Michelle Digans Ramsing, she says, good night. What to use to get rid of muscle knots? How you know you have muscle knots, Miss Digans? How you know it's not poor circulation? Is it that you're getting pins and needles, cramping your calves, burning under your feet? Is it that you feel very tired? You feel as if it is your muscles are paining you, especially in the calf area? Pleasant good night to Nita Cooper. Keisha Savri says bad. Yeah, it's bad. It's real bad. Donna Howell, bad. It's horrible. But I'm just giving you those two examples to help you to understand. When you have hormonal imbalance, you are fighting a losing battle if you do not know what to do. You will end up killing yourself. You all know me, you know. I give you all it as plain as day. I'm not going to nice it up and put a cake and put a bow on it. I don't have time for that. You have to fix yourself. You have to. Ms. Rosemary Bishop says, Dr. Batson, I want to do the test, but I cannot visit TNT until next year, please God. Is there any way I'll be able to do it? I'm in New York. The thing is, I'm not aware of, as of now, because I know a lot of persons change practice and that kind of thing. I'm not aware of anyone who does blood analysis in the United States. As regards to, and I trained in the US to do blood microscopy, Chicago, Atlanta, Florida, Miami. So I do not know as regards to New York if there is anyone. What I could find out, as I always tell you, we have to be practical in dealing with persons. If you live halfway across the world, and if there isn't anyone who does blood analysis, magnetic resonance analysis, and those type of things, a neuropathic or naturopathic doctor, I don't need you to go to them. I would request specific blood tests, laboratory blood tests. I will ask you to do them. You get them, you send the results, and then we do our consultation. So we could help you either way, you know. But I'm talking where I am, I would obviously be able to operate at my best, at my fullest, and I'm in Trinidad and Tobago. So as a result of that, in those clinics, we're able to do the blood analysis, the dry blood, the live blood. But we're not going to allow that to disrupt us from helping you, Miss Bishop, or helping Miss, who was the other young lady? I can't remember your name. Somewhere up here, who you told me you were from New York, and I told you to do the consultation. Miss Melissa, we're not going to allow that. You think we should allow where you live to determine whether we're able to help you or not? People, we have FaceTime, we have Facebook, we have Zoom call, we have, no. We live in a digital age. Connectivity is excellent. Connectivity is out of this world. I am not performing surgery on you. I don't have to touch you. You don't have to be in front of me physically. We would like that experience, but in practicality, that can't happen. So what you're going to do? Wait until next year or the year after? No. You don't want to get better. And I'm saying that again, not to be condescending or facetious, but I am simply stating, in my opinion, what is the most sensible thing to do. I am not about wasting time. There are too many people to help. We have too many clients. No, but we don't have too many clients. We have a lot of clients to deal with. So we want to get you, and we're not hurrying or hustling. You know, ask anybody who comes to us. Sometimes when you're waiting to see me, you have to wait, you know. Because if I go in that room, and when I'm dealing with a client and I'm looking through those things, and I see issues, I have to make sure and do my job properly and make sure and properly, and all my consultants do that. All our consultants do that rather. So we're not going to give you any slipshod work. We're not going to do that. I don't do. What they say, hurry bird don't build goodness. We don't do that. We ensure that we're giving you a proper assessment. But I could do a proper assessment with certain blood results halfway across the earth. That does not interfere or impede me from being able to make specific recommendations from a nutritional wellness perspective to help you to get better. Understand that. I want you to understand that, because a lot of people don't get that. Good? We're not wasting time here. You're halfway across the earth and across the world and you're dying? Nah, man. You waiting to take a plane? Now, notice I am not speaking about you specifically, my dear. I'm just making a general observation as regards to that. So the telephone numbers are there. Keep in mind our open clinic days and our locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. That telephone number you can call there is 222-8261. You could also WhatsApp us on the 314-9975 number. Keep in mind, when you call the office, remember why you called us, please, because we call back people or persons. We're going to call you back in the morning, please God, or send you a message. So we know you might be busy or whatnot, but the reason why you call is because you are interested. Good? So we're going to ensure that we follow up with you to ensure that you get the information that you were requesting. Good? Let me say, of course, a pleasant good evening to Miss Kamina Love. She said, yes, I had to wait 2 hours, but I was very much satisfied. Exactly so. So this face, the face with Dr. Batson, everybody can't get that. And I tell you that because at the end of the day, you need to get better. And any one of the consultants, I have people who came to me that I've never seen. And I say that because practically I couldn't see them, but they were seen, they got results, they were impressed, they were satisfied. That's what we want. Systems work, people fail. Always remember that. Ms. Marge Hill says, check yourself before you wreck yourself. Correct. A pleasant good night to Ms. Kamina Love. Ms. Donna Howell says, I will definitely be booking a call. I am in BC, Canada. Yeah, we have to help you. Easy, that's easy for us to tell you what to use. We tell you how to use it, we tell you the recommendation, and then we do your review at a certain point in time. If a month after we do our next consultation, because we have to ensure that we dot our I's and cross our T's, but we're going to get you better, regardless of where in the world you are. We live in a digital age. Connectivity is just that connectivity. They're sending people on the moon. We can help people who are sick halfway across the world. Come on, man. Miss Rosemary Bishop says, I know you all are good. My brother Hayden Stewart was there recently. To you all, and he gave me excellent reviews. I am the one who recommended Batson and Associates. Okay, Miss Rosemary Bishop. Oh, good. And I know he bought back some products for you, right? Miss Jackie Johnson says, good night, Dr. Batson. Thank you for helping me to get my product, and thanks for taking good care of my friend last Wednesday. She came from Florida. You're very welcome, Miss Johnson. I remember and I understood that you got your products, thank God, and you are starting on that journey to, you know, take better care of yourself, or take supplementation as regards to really improve the body. Miss Nicole Vanderpool, she says, Dr. Batson, do you have anything for someone with misophonia, extreme sensitivity to noise? Well, look at that. First time I ever heard the name of that. First of all, I have ever heard about. Okay, anyone who would have extreme sensitivity to noise, that would be an imbalance of the central nervous system. So I'm quite sure that we could deal with that. What I could recommend off the top of my head would definitely be the Alcogen water, the Nerve Restore. Nerve Restore is amazing. I thank God for that product every day. That's one of the products that help me function, to be able to come and do these lives that I do, and to be able to interact with individuals, because I have to ensure that what is in here is able to come out here, right? So the Nerve Restore. I will also look at the anthocyanin complex. That's spelled A-N-T-H-O-N. Anthocyanin. Anthocyanin complex. I could always spell it there for you guys. All right, Ms. Vanderpool. Definitely, that is something that would be able to give you some assistance. Keep in mind, in terms of drinking water, you should be drinking your body weight divided by 2 in water. So that's the Alcogen water. You're looking at your Nerve Restore. the anthocyanin complex. What again would help you in that situation as well, boy? The inflammation formula is also a good product too for that, because the inflammation formula helps to reduce the inflammation in the body. Right, so I put it there. Yes, he did. I started, but I want to do a consultation. I started with the regeneration circulation tea. Okay, good, no problem. All right, so what you will do, Miss Bishop, is we could reach out to you. We could schedule that consultation for you and start to help you in that particular situation. Okay, you're very welcome, Ms. Vanderpool. Okay. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. Keep in mind, those of you in Trinidad, the Debe office, the 27th and the 28th of September, as well as the St. James office, we have open clinic days. So you can call the telephone number and you can have your bookings for that. So it would be a clinic where we have an interchange as regards to that. So if you're doing a test, that is a Friday and a Saturday. So take advantage of that. That is the 27th. Let me give you those dates. So that is going to be Friday, the 27th of September, and Saturday, the 28th of September. That's the Friday and the Saturday. And those clinics would be the St. James Clinic, which is at Red Edge Mall, Western Main Road, St. James, and the Debe Clinic, which is the corner of Ramsamud Trace and the SS Erin Main Road in Debe. Very, very important. Okay, Tobago is actually the 9th to the 12th. So Ms. Ramdan is actually in Tobago right now. So those of you in Tobago could actually have your blood analysis. Ms. Ramdan worked in Tobago today. She's also working tomorrow. And yours truly would be doing reviews on Wednesday and Friday. Wednesday and Thursday, my apologies. Okay, so take advantage of that. That's the Tobago office. That office is in the Triangle building in Scarborough, Tobago. Good. So try and take advantage of that situation. We also have Debe. We're going to do a pop-up the 21st of September. We have a pop-up promotion in Debe. That's at Debe office, where we'll be highlighting weight loss. We'll be also promoting those integrative clinics that we have. So those of you, the Londonville location that we have, that integrative cardiovascular clinic. So that integrative cardiovascular clinic is dealing with persons who have problems with hypertension. If you have had myocardial infarctions or what are known as heart attacks, also if you had issues associated with poor circulation, so things like deep vein thrombosis, clots, it's very, very important. It's essential that you pay attention to that. You know, one of the things I was saying yesterday is, ladies, I'll tell you something. If you have hormonal disruption now, do not take and play the fool with that. I'll tell you why. You are going to end up in a situation where you put yourself to end up in the madhouse. And listen to me, I say that without any kind of, it's not a matter of being facetious, it's not a matter of laughing, it's not a matter of kissing. It is a matter to understand where there is smoke, there is fire. If you know you are experiencing hormonal imbalance problems and you leave it, you are going to end up in a severe, severe situation where you could either end up suicidal, you could end up with serious, serious insomnia. Listen to me. Insomnia is not, listen, when you sleep deprived, you are damaging your central nervous system. Your autonomic nervous system is one of the most important aspects of your nervous system. That's your parasympathetic, sympathetic nervous system. That is responsible for a number of things in the body. So where there is smoke, there is fire. This is something I was helping you to understand yesterday. Because let me tell you something, break it down. Let's break it down in dollars and cents. right? So you do not pay attention to yourself. You're going to, first of all, a regular doctor cannot recommend psychiatric drugs for you. So you're going to have to go to a psychiatrist. So that's one set of costs. Then the medication they're going to recommend for you, that's a next story, because they're going to interfere. You're going to have problems with your liver. You're going to have problems with your kidney. It's going to affect your brain chemistry. Anytime you have to take sleeping tablets, you are in a complete and total mess. And if you leave it, you are going to get in a worse and a worse, because that is going to be compounded. It is going to become cumulative. It is going to be progressively get what? Worse. Progressively get worse. So save yourself all that drama. You'll ever see anybody with hormonal imbalance? Or ever see anybody going through bad menopause? I telling you, you wouldn't wish that on the worst person you dislike. You know, people say you wouldn't wish it on your worst enemy. I tell you, you wouldn't wish it on your worst enemy. It's not nice. You know what to say? Imagine to see all your good hair falling off your head. I don't know how women just deal with hair loss. Alopecia. What is alopecia? Alopecia is an inflammatory condition of the scalp that is easy to fix. Easy to fix. But it requires what? Consistency and discipline to the protocol that you need to follow. You cannot come, if you have alopecia, you are seriously devoid of nutrients. You are, what's the word I'm looking for, boy? You're malnourished. Seriously malnourished too. So if you're malnourished, then obviously the body is not getting proper food, or the body is not assimilating things properly. What does the word assimilate mean? To digest, to break down. So a lot of persons taking in things. That is why one of the things we do at Batson and Associates, when we deal with any of our clients, we ensure that we do work on your gastrointestinal system. Very, very important. If you don't do that, you're wasting time. You're spinning top in mud. And that is why it's important to have the blood analysis done. So make the appointments. Keep in mind those of you for St. James, the 27th and the 28th, as well as those of you in Debe. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. And St. James is Red Edge Mall, Western Main Road, St. James. That telephone number for St. James again, or the telephone number you can use, you can WhatsApp us on 314. That is 314-9975. Again, that's 314-9975. Call, make the appointments. Keep in mind, Shogunas is the 14th, the 17th, and the 18th of September. That's Shogunas. Okay, Miss Rosemary Bishop, she says, okay, thank you, Doc. I will call sometime next week. No problem. Abeline Hughes Bernard says, good evening. Can you answer my question, please? Okay, Abeline, what was your question, my dear? Let me see if I find it. All right, Abeline, give me 1 second. I'm going up to see if I see your question. Keisha Savri says, let me see. She says, I'm in a lot of pain. Let me just answer this question here. I'm looking for your question as well. But let me answer Keisha's. I saw this one because I didn't get this one. She says, I am in a lot of pain weeks before my period. My breast, headache, hips, back, nauseous. And it is very heavy lately. Is this a sign of hormonal issues? Yes, it is. Clear. That's like God talking to you today. You can't get clearer than that, Keisha. That is serious beginning of hormonal imbalance. And as I tell ladies, listen to me all here. You don't want to leave that to get bad enough. I tell you all, I am doing this 15 years now. I have seen some women with hormonal disruption. It is not a nice thing. Okay. Laurie D. Alexander says, how do you know which hormone is imbalanced? Do you test different hormones? You could test different hormones if necessary, but I wouldn't go through that. That doesn't make any sense. You have money to spend, you have money to waste. That's wasting money. I have seen people do number of tests that I don't understand why they make all the waste money to do all those tests. That was just wasting your good money. You could have taken that money and get assessment and get things to put into your body to make the correction from a nutritional perspective. So, Ms. Savary, that is a clear indication of hormonal imbalance. And listen to me, if it is that bad, believe me, you don't want to leave that as is. That's going to get worse than that. Ms. Laurie Alexander, what I suggest you do, as I mentioned, you have to, if you see, the thing is, and this is our next thing. Let me expand a bit on Laurie's question. A lot of the times you're looking for answers and the doctor's looking for answers in the wrong places. Sometimes your symptomology is not, your diagnosis a lot of the times is not important, you know? And I've said this on numerous occasions. Your diagnosis is not important. Now people come to me and tell me they have diabetes, and I really don't care what you're telling me because you're not making any sense. You may be pre-diabetic. You know, people are not diabetic, and the doctors tell you you have diabetes, and you're taking metformin and taking insulin, and you don't have any diabetes. Your problem is a different problem. Remember, you could get a diabetic symptomology and not be diabetic, you know. I wonder if you understand what it is I'm telling you there. There are numerous issues, there are numerous imbalances in certain parts of the body that can give you diabetic symptomology. Tell me if you're understanding me, or you think you're following me? There are numerous symptomology in the body. You all know what a symptomology is, right? A symptom. All symptoms have a root cause, every last one of them. Every last symptomology has a root cause. Don't let anybody fool you and tell you nonsense. Constipation could cause you to get a diabetic symptomology. Thyroid problems could cause you to get a diabetic symptomology. Chronic inflammation could cause you to get a diabetic symptomology. Does that mean you are a diabetic? Answer that question for me. Tell me if that's making sense. Acid reflux. All the acid reflux people, throw your hand up in the air. Once you have had problems with your stomach, if you do not fix that, you are in problems. It's just a matter of time. You know. How will you think people just get diagnosed with cancer? How will you think people just get cancer just so? You think it's just so you just get cancer diagnosis? People who get cancer, most of the time, did not pay attention to their bodies. Again, I'm not attempting to be condescending. I'm not attempting to be facetious. I'm not attempting to be rude. If you think I am being rude, well, such is life, but I am not. I'm very plain spoken. You don't get cancer just so. So when it is you have all them problems, and then you hear what and Keisha are just making note of you, like with that. That is you in a state of affairs, girl. You want to fix yourself. That is not good. You say, I am in a lot of pain weeks before my period, you know. My breasts, headache, hips, back, nausea, and your period is beginning to come very late. Is that a sign of hormonal issues? Of course, that is a sign of hormonal issues. That is smoke. That is the smoke before the fire. You will be in a lot of problems later on in your life if you don't fix that. And that is the problem with a lot of y'all. And I'm not saying this, Keisha, keep in mind, I'm answering your question. I'm not bashing you, my dear. I'm simply using it as the platform for what I'm saying here. Do not wait until those things get worse. All it is waiting. Plenty people who get diagnosed as mad people with, or insane people who are having problems with bipolar and schizophrenia. That was not what happened to them, you know. These people got nervous breakdowns, you know. Their central nervous system break down, and depending on the area or the part of the central nervous system that breaks down or that is affected, it is going to determine the symptomology that you have. That is simple common sense. Simple common sense. A lot of persons who have been diagnosed as mad, you were not mad. The unfortunate thing is all it takes so much medication that you all are very hard to fix. Because when you interfere with your brain chemistry, take what I'm telling you, that's one of the worst things you could do. It messes you up. Messes you up really badly. You ever see anybody who's been on sleep medication? You all ever observed that? They never, you're always sleepy, always drowsy, always druggy. You can't make no kind of sense out of nothing. You have to deal with the root cause of the problem. So again, feel free to give us a call or visit. Those telephone numbers again are of course 222-8261. That's 222-8261 or 314-9975. Again, that's 314-9975. 9975. Okay, let me go back to the question that I was looking for, because I saw two questions. Let me see if I come down here. Okay, so Abilene Hughes Bernard says it's on top Miss Bishop's question. Abilene Hughes, let me see. Abilene, you might have to ask me back that question. Yeah, I don't know, for some reason, I don't know why I'm not seeing that question again. All right, just now, let me take my time. Let me go up. Rosemary Bishop. Right, I'm seeing what she, Kamina Love. Abilene Hughes Bernard, good evening. Can I take supplements while I am taking Santulan? Oh, yeah, of course, you can. That's not a problem. Remember, your supplements that you usually take, you will take with your breakfast, your dinner, or your lunch. Santulan is to be taken on an empty stomach. So I'll give you an example, Miss Hughes Bernard. Let's say you take a vitamin A, B, C. You have breakfast, so you take your vitamin A, B, C with your breakfast. Santulan is to be drunk on an empty stomach. An empty stomach is usually either an hour before or 2.5, 3 hours after a meal. So let's say you have your lunch 1, 3 hours after your lunch is 4. You can have your Santulan, and that would not affect the supplements that you're taking. Okay, Ms. Hughes Bernard, nice. Ms. Wendy Andrews says, I'm interested to know about liver stress, Mr. Batson. Well, the thing with liver stress, if you are diagnosed as having a fatty liver, you have liver stress already. There are a lot of people who are diagnosed as having fatty liver. Fatty liver is a clear indication of liver stress. And it is an indication that your liver is starting to not function the way that it's supposed to. Pay very, very close attention to that. Okay? All right, Miss Hughes Bernard. So you can, okay, she says, thank you, you're very well. Miss Donna Franklin said, extremely informative. And watch me, if you do that blood analysis, and if you come to Batson and Associates, if you think information, you ain't get information yet, my dear. Take what I'm telling you. Let us do that blood analysis for you, and you will see information. There are people who have been sick for years, and it's only when they come to Batson and Associates they get answers, you know. Headaches. Bring anybody, I'm telling you all, I challenge you all. Bring anybody with headaches. Bring anybody who cannot sleep. But they have to follow the protocol. They have to get the assessment done properly in order for us to help them. Rosemary Bishop says, Dr. Batson, I agree with you. My sister was just working and not taking care of herself and was diagnosed with stage 4 pancreatic cancer. Just lost her March this year. I'm sorry to hear that. Yeah. You have to take care of yourself. You have to check yourself. You don't get cancer just like that. You don't. Santulan. Santulan is a 7-channel detox that we have. That product is designed to clean and detoxify kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Listen again, you know. Kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. You don't think, if you take that product, you don't think that product can help you? Obviously, it could help you. Miss Donna Franklin, she says, I'm currently drinking Santulan. And Miss Franklin, what is your experience so far? If you want to share. How it going? Okay. Let me just address Miss Marva Huggins. She says, good night, Dr. Batson. What can I do for high pressure in my eye? Miss Huggins, if you have high pressure in your eyes, you need to do a system. There's a protocol for that. One of the first things you need to do, Miss Huggins, is to go and test the pressure in your eyes, and you have a record of the pressure. You are going to have to get the eye optics formula is one product. You're going to have to do a consultation because glaucoma is a serious, serious thing. But I have helped numerous persons bring down that pressure safely. Because let me tell you something with glaucoma and glaucoma patients. It is very easy for you to go blind when you have glaucoma. Very easy. Very, very easy. So those are some of the things that you need to pay close attention to and organize. So again, feel free to give us a call or visit. Keep in mind those open clinic days. We're actually having a symposium. We were supposed to have the symposium at the end of September, but we had to change it. Right? So we're going to give you all that new date. Keep in mind our new integrative cardiovascular clinic. So with that clinic, we're going to have to do the echocardiograms, the ECG, and plus our integrative testing. Those clinics are strictly by appointments. So that's the integrative cardiovascular clinic, the integrative diabetic clinic, as well as the integrative musculoskeletal clinic. So that's people who have rheumatoid arthritis, psoriatic arthritis, osteoarthritis, all those type of things. Okay, guys? Ms. Donna Franklin said it's going excellent. No bad taste and ease of joint pains already. You'll see? She said she's now using it, Ms. Donna Franklin, right there. She says, excellent, no bad taste and ease of joint pains already. How long have you been using it, Ms. Franklin, if you don't mind me asking? You're very welcome, Ms. Abeline Hughes Bernard, Ms. Wendy Andrew, you're very welcome as well. Okay, guys? Now, ladies, the product I want you to check out for hormonal disruption is Women's Formula, and also check out the Nerve Restore. Really, really good product. Excuse me a minute. Good. If you have a problem with glaucoma and you're serious and you want help, because let me tell you something, we have help persons with their eyes. You know? One of the next clinic we're going to do is an integrative eye clinic. Glaucoma, cataract, detached retina, serious inflammation in the back of the eyes, those type of things. Very important. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. That number for the offices is 222-8261. That's 222-8261. And of course, the 314-9975 number, you can get, you can WhatsApp us. Okay, Ms. Donna Franklin says, this is my second week. Good, I'm glad to hear that. Ms. Beverly Davis says, what do you have for fibroids? Okay, the next devil, and when I say devil, I'm not referring to you and Ms. Davis, I'm referring to the fibroids. Okay, so let's break down fibroids a little bit. What are fibroids? Fibroids are growths. They are very large, or they depend on size. They can vary in size rather. There are 5 types of fibroids that you have. Fibroids are given their names based on their location. You have intramural fibroids, which are in the walls. Those are the worst. You have subserosal fibroids. You have you have intramural. You have submucosal. You also have pondulated and 2 others. There's 5 in all you have. Okay? And it is very important with fibroids to come off of the women are told that when they go through menopause that their fibroids calcify. Do you want to have a calcified fibroid inside of you? Why would you want to have that there? You don't want calcified nothing. That's like having a calcified big stone in your womb. Why you want that there? You want that out of there. So there are things that we have for fibroids, but fibroids always require a particular protocol of more than one product and a specific dietary recommendation. You cannot have fibroids and eat everything. You know, some of your licorice, you like to eat everything in sight. You have no kind of discernment or discretion when coming to food. You eat every single thing in sight. You cannot have fibroids and have that. For example, you cannot have fibroids and consume pork or red meat. You cannot have fibroids and eat chicken. You cannot have fibroids and consume large amount of coffee, which a lot of people do. In fact, you cannot have a lot of things and be consuming coffee. Coffee is going to increase chronic inflammation in the body unless it is a healthy coffee. And that's our next discussion where that is concerned. You have to dot your I's and cross your T's with those. Okay? Ms. Nita Cooper says, yes, Santulan works great. I have used it, really does work. And when I finish my course, I did back my blood analysis and my results came back good. Okay, so when she finished her course of Santulan, she said that she saw improvement. Santulan is an excellent product. It is a 7-channel detox. It is designed to clean and detoxify kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. You all see it? I ain't paying none of these people to say that. These are people who would have heard the life, came to Batson and Associates, either did the test or bought the product, and those are the results that they're saying. There was a lady on last night where she gave a testimony about her granddaughter. She said she know Batson and Associates know what they're doing because her granddaughter came. She was having problems with getting pregnant, and now she is well on her way to having a grandchild. You see? But we always tell them that you have to follow the protocol. What is a protocol? A protocol is a specific standard way of doing things where there are recommendations, there are dietary recommendations, supplemental recommendations, clinical nutritional recommendations. But the problem with a lot of persons is that they wait too late. And let me tell you something. People talk about money. A lady said, talking about, sir, you know, you have to save money to come by you. That is not true. People say I'm expensive. I don't understand what they're talking about. But expensive is a relative term, so I could respect that. So we'll agree to disagree. But I could tell you, you see what I told you about cancer? You could imagine, God forbid, you go and get a stage 5 cancer diagnosis. I have seen people with cancer. They didn't come to me. Some of them came for consultation. They listened to what I say. Some of them didn't listen. Some of them are not here again. God bless them, but they're not here again. And a lot of the times it's because they took too long to take care of themselves. Don't make that mistake. This tea here that we have here, this circulation regeneration tea, is almost guaranteed. Almost, eh? I don't give guarantee. The only guarantee I have is with God. Always remember that. No man, no human being could give you a guarantee. But I'll almost come close to giving you what resembles a guarantee with this circulation regeneration tea. And anybody who has blood pressure, I challenge you. If you have high blood pressure and you want help, you give Batson Associates a call. You give us a visit. I had a client who came to us. She couldn't sleep for 20 years. You know. You could imagine her not sleeping for 20. I don't know how she didn't kill somebody or run off a cliff or something. I wouldn't have been able to function. Because I love to sleep. I don't make joke with that. Love to sleep. Because I work very hard. And when it's time for me to rest, I take my rest. I put my phone and throw it somewhere. I don't want to hear nobody. I don't want to talk to anybody. I need to rest. So you could imagine when you are sleep deprived and you cannot rest and you counting money. Anybody, I challenge you, anybody who cannot sleep, I challenge you. You come to Batson and Associates and follow the instruction. That is the key thing there. You ain't coming here and doing what you want. We don't operate so. You see Miss Donna Franklin said, what she said about Santulan? Because she using the Santulan the way we recommended the Santulan. Look, she said it for herself. She says, I'm currently drinking Santulan. She said that at 9:29. At 9:31, because I asked her a question, I said, how it's going? She said, excellent. She even said, good enough. She said, excellent. She says, no bad taste. And it has already eased up her joint pains already. Look at right there. I didn't type that. It have people who serious. It have serious, serious, and serious. If you're serious, then we'll be able to help you. You know, games and play and laugh. We don't have time for that. I most certainly don't have time for that. We have the consultants. We have the clinics. Come and get your stuff done. You do not need to specifically see me. At some point in time, you could see me, you know. But I'm telling you, well-trained consultants, well-trained. It's a well-oiled machine. Right now, we're doing some work to the machine. We're changing some parts and things. But it's a well-oiled machine. Well-oiled. I had a client from Tobago call me, and she's going to give me a testimony. Yeah? She promised me that. This lady blood pressure used to be 200 and something over 1 something. Do you know what damage takes place in your body when your blood pressure read at those levels? Excuse me. Do you know? Terrible. Terrible, terrible, terrible things happen to you. You could have had mini strokes, what are known as ischemia or ischemic lesions. in the brain. All of a sudden, you ain't remembering properly. Your eyes, your poor eyesight, blurred vision is a clear indication of poor circulation to the brain. Clear. Santulan is not $1 million. I always tell persons who plan to use Santulan, here are the people who cannot use Santulan. If you have low blood count, do not come and buy Santulan and use it. You need to do a consultation. And all these lives are taped, and I would have told you. And then we'll tell you that when it is you come. If you have low blood count, you do not use Santulan just like that. You must do a consultation. A consultation is not $1 million. Come and do your consultation so that we could properly assess you and we could properly help you. We have to ensure that we dot our I's and cross our T's. As a specialist in integrative medicine, if it's one thing they could say about Batson and Associates, we are very, very, very thorough. Very thorough. Very. There's a reason for that. Headaches. That lady had headaches for 20, not headaches, sorry, sleeping problems. She couldn't sleep for 20 years. When we were finished with that lady, you know when she started to sleep? 2 weeks after. And she has been our client for over 3 years. And sleeping like a baby up to now. She said, Dr. Batson, God bless the day I put on the radio and I hear you. Anybody with any sleep problem, I challenge you. You're having problems sleeping? You just listen. Keep in mind, you must be able to listen. If you know you're hardened and you don't listen, you have supplements, you open one pack of the supplement, you use one every 3 weeks, every 5 weeks, you don't listen? No. No. Get correct, right? Listen, you must be able to listen and take instruction. And that is not me attempting again to be condescending or anyway. You have to take instruction. You came to the specialist. We are the specialists in this field. You think we're going to give you bad advice? No, we want you to get better. We want you to get better so you could go and tell other people you get better so we could get more people to come and we can help more sick people. You think we're going to deliberately do something to make you sick? Of course not. But you have to follow the instruction and you have to, y'all, come and have your consultation. Dr. Batson, I'm not saying I give a lot of information here, but a lot of the information I give is not necessary. It's going to be broad. It is not necessarily specific to you. So pay your money and come and do your consultation and mind your business. Come and get your blood analysis, right? Because it is imperative, it is pertinent, it is vital, and wherever would you think you can put there again, that you come and follow the process. Okay? Rianne Fraser is saying, hi, good night. What do you recommend for high blood pressure at nights? Well, the thing is, if you have high blood pressure, okay, so what is your blood pressure in the morning? Miss Fraser. Rochelle Parsons Matthew says, Dr. Batson, I have poor circulation because of blood clot in my left leg. Can you help me? I'm in Georgia. I can help you, Miss Matthews. What you're going to have to do is get the number. Send us a message, please, on our WhatsApp. That is 868-314-9975. And you have to do a consultation with us. We have to get all the information, and I will help you. Okay, Miss Matthews? But you have to do it like that. Those type of things require a proper consultation. All right? Job Fortune says, do you treat stroke patients? Yes, we do. That is one of the things that our integrative cardiovascular clinic will be doing. That is the clinic that is located in Londonville. The telephone number for that clinic, and this clinic is by appointment only for now, because of the type of work that we have to do in that clinic. The number for Londonville clinic, where we have the integrative diabetes clinic, the integrative musculoskeletal clinic, because that clinic is at ground floor. So in central Londonville is where that clinic is located. The telephone number for that clinic, I want to have it put up on these things for you guys. It's 396. That is 396-6936. So it's 396-6936. Okay? And we can help you with that. All right. Rayanne Fraser says 120 over 85. So if it's 120 over 85 in the morning, what is it in the night? Donna Franklin says prevention is better and cheaper than cure. You're sure right. But after midnight, it goes up to 140 over 100. But Ms. Fraser, let me ask you a question. Why after midnight you're testing your blood pressure? Is it that you're feeling, with that blood pressure reading like that, do you feel like your heart is racing off? Answer me that question. Okay, while she answers the question, keep in mind those telephone numbers and locations. Keep in mind the walk-in clinic in St. James. Now, we always have walk-in clinics, but the 27th and the 28th of September, we have a special clinic in St. James. And the Shogunas is the 14th, the 17th, and the 18th. We also have Tobago. Those of you in Tobago, you would be able to get an appointment between the 9th and the 12th of September. So that is from today. Ms. Ramdan is actually in Tobago right now. She'll be working tomorrow, please God. So you could have your blood analysis, your magnetic resonance analysis. And yours truly, Dr. Batson, would review either the 11th or the 12th. Those things would be reviewed. Okay? So that office number in Tobago, you can give Tobago a call, and we'll be able to address that situation. Jean Harry says, good evening, Dr. Batson. What causes protein to be in your urine? Kidney problems. And that is an alarm. That is a bell. When you see that happening, you are at death's door. Mind your business. Protein in your urine, never a good thing. Never, ever, ever, ever a good thing. That is an early warning sign of renal problems. Ms. Nicola Heard, my dear, blessings to you. Ms. Rayanne Fraser says the reason why I feel neck stiffness and sometimes I feel my heart is racing. Exactly so. Because it's only because a situation where a panic attack, where you have some sort of hormonal disruption problem, where you're going to go up that hour of the night where you get a blood pressure of 140 over 100. How much is your pulse, Rayanne Fraser? How much is your pulse? So again, check those telephones. So while I speak with Rayanne Fraser here and she thinks, she will answer. Jean Harry says, so can you help? Yes, I can. I'm telling you, I can help that. What you need to do is you come with the blood test that you have, and we will do our blood analysis and our scan. Choose which office is more convenient for you to have it done, and you can send us a message on the 314-9975 number. Rayanne Fraser says 85. Okay. All right, Rayanne, I believe you want a little fixing. You want a little. When last you take a detox, Rayanne? Answer that question. Rayanne, take over the class right now. Rayanne making sure and get she consultation here, or at least part of the consultation. You still have to come in the office and do the test and thing for you to fix you up good. But I will fix you. I don't realize or having a fair idea certain things. It's just one thing that we would need to check as regard to that. She says, but I usually take atenolol in the morning and amlodipine and lisinopril. So while you're taking those medications, it means that you would have been diagnosed as having hypertensive from before, correct? Jean Harry said the test was done at the health office, so I don't have the results. Okay, no problem. You come, you will have to do the blood analysis, the magnetic resonance analysis scan, and then if I am going to have to, we're going to have to do a referral letter to tell you to get which test is done. But we will correct that. But I'm telling you, protein in your urine is never a good thing. Never. Okay? Rayanne Fraser said, I did the test already. Which test you did, Rayanne Fraser? Our test? Answer me that question. And if you did our test, only started spiking the last month. Okay. And how long ago you did our test? Help me out there. So those telephone numbers, again, you can get us on 222-8261. That's 222-8261. And our WhatsApp is 314-9975. Okay, 2 months ago. Okay, so Rayanne, with the products that you used from 2 months ago, did you see an improvement with that? Because they say you wasn't getting that all the time. Did someone from our office contact you again? Did you get a review call? Or did you come for your revisit? Answer me that. Okay, so again, those telephone numbers and locations were located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. That telephone number for Chaguanas is 222-8261. That's 222-8261. And the WhatsApp is 314-9975. That's 314-9975. Ms. Jean Harry said, I also having an ultrasound tomorrow, please God. Very good. Well, the thing is, when you're doing the ultrasound, they wouldn't be able to give you the ultrasound right away, but you should get at least get the ultrasound results. If you're doing it in the public sector, that might be a little difficult to get, right? But as I said, give us a visit and let us start to deal with that. Okay, so Rian says, I did, and they recommended the circulation tea, which I'm using. I have not done the revisit as yet. Okay, well, you need to do the revisit. Okay, so let me ask you a question, Rian. So based on what you used from us so far, what results or what improvement you saw, if any? Tell me. Okay, keep in mind again, those clinic days, the days again, the walk-in clinics in St. James. St. James is usually a Friday walk-in clinic. That clinic usually starts from 9:30 in the morning. I am not there from 9:30. I usually have evening appointments based on my schedule of meetings and whatnot that I have to do. But we usually have an open clinic day on Friday and some Saturdays, Saturdays as well in St. James. That office is located on the first, St. James's Red Edge Mall, Western Main Road, St. James. We also in Davie. Davie is the corner of Ramsonwood Trace and the SS Erie Main Road in Davie. Okay, Ms. Donna Howell asked, Dr. Batson, can you speak on the topic of polycystic ovarian syndrome? Based on the time that I have, I will touch on it a bit. PCOS is a clear indication of hormonal imbalance. You don't really have much to say about polycystic ovaries. If you have polycystic ovary, it is a clear-cut indication that you have hormonal imbalance. You need to fix those hormones, or it is going to get worse. Women who end up with uterine cancer, ovarian cancer, vaginal cancer, all of them, every last one of them had hormonal imbalance for years that they didn't deal with. So if you have polycystic ovarian syndrome, you are in a serious, the ambulance coming already. You see, the problem with most doctors, the thing with me, as opposed to most doctors, I do not just make things sound very minuscule. The problem with a lot of doctors in Western medicine is that they make things sound minuscule. You know how much people came to me with fatty liver and they didn't know how bad fatty liver was? It's only when I started to talk about how bad fatty liver was, a lot of people started to say, oh, fatty liver. All the time they're telling you if you have fatty liver, that is okay. That's normal. It have doctors that tell you if you have ovarian cysts, that is normal. Normal what? Normal that it means that you're sick and your body is telling you something is wrong with you. People just tell you kidney stones is normal. Kidney stones is not normal. If you had kidney stones, something is wrong with you. We tell them about normal. That doesn't make any sense. Where there is smoke, there is fire. Polycystic ovarian syndrome means that your ovaries are polycystic in nature. That doesn't require much explanation. Polycyst, it means that they have cysts. So on the ovaries, you're going to see a set of cysts. That is interfering with the functionality of the ovaries. Your ovary can't function properly. That is going to interfere with pregnancy. That's going to interfere with procreation. That's going to interfere with your menstrual cycle. That's going to interfere with your mood. That's going to interfere with your sleep. That's going to cause headaches. That's going to cause problems with being lethargic, low energy. A lot of problem. Rianne Fraser says, I have felt much better using the products. I have seen improvement with my menstrual cycle and have more energy compared to before. Okay, Rianne, great. So what we need to do, Rianne, is dot our I's and cross our T's with that panic attack bacchanal you have in there. So I suggest you could send your information again for us or call the office and have a revisit. Have your revisit done. Okay, Rianne? Colin Joseph says, what about gout? What can we do? Well, gout, if you have gout, you're in a mess. You're dying already. Gout is excess uric acid. I ain't going to baby all and tell all you, like what them doctors is tell all you, and all they dying there and all they don't know nothing. No. If you have gout, you have excess uric acid. And worse yet, if Colin dies your picture there, and if you're talking about you, because you're looking like you're young, well, now you're in an even bigger mess. You need to fix that. Or whoever you're asking for. Gout is high or excess uric acid. When uric acid is excess in the body, it stores itself in the joints. Say, under a CT scan or MRI, it actually looks like fine long needles inside of your joints. Pain like that. The doctor's going to give you allopurinol. Okay? But, yeah, the but. You have to deal with the root cause of the problem. High levels of acidity, uric acid, and chronic, finish the sentence for me, chronic inflammation. Good? Ryan Fraser says the Santulan works well. I have much better bowel movements as well. Good, I'm very glad to hear that. So you see, Ryan, you're well on your way to getting better. So organize your revisit. Your revisit does not have to be with me, because if you want it to be with me, it's going to take too long. Have your revisit, come and see one of the consultants, and let's finish and fix that blood pressure and that pain you're getting in the back of your neck in the night there. Okay? Nita Cooper says, I take women's formula daily. I think women's formula, yeah, you wanted to say daily, you said lady. Okay? So again, those telephone numbers and locations, keep in mind the WhatsApp number. That is 314, that's 314-9975. Again, that's 314-9975. You can WhatsApp us, call, and look out for those clinics. Those of you for the stroke, the integrative cardiovascular clinic. So let me set the stage one time for y'all. If you have problems with poor circulation, you have clots in your leg, you have clots in your lungs, that clinic is for you. That clinic is only by appointment. We have the integrative cardiovascular clinic, the integrative diabetic clinic, the integrative musculoskeletal clinic. So that musculoskeletal clinic deals with people with rheumatoid arthritis, osteoarthritis, psoriatic arthritis, all those various types of arthritis. Okay? And that telephone number for those integrative clinics, which are only by appointment at that Londonville branch, that telephone number is 396. That is 396-6936. I'm going to have that on the prompt, like how we have it below. In the meantime, what you could do, you can message us on the 314-9975 number. And remember, if you message us, we're going to call you. If it is you're not ready now, you want to find out about Santulan and whatever the case, maybe you're busy, we will just ask you for a more appropriate time to call you. You called us, and we are returning the call. Okay, guys? Ms. Sharon Hill, good evening to you. Right, so I believe I answered all the questions that I would have gotten. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. So this program basically has gone on for almost an hour and a half. I will finish at 10:05. So those of you who have any questions, now is your chance to ask the questions quickly before I leave. Someone I saw ask a question on adenomyosis. The thing is, if you have adenomyosis, the cardiovascular clinic, this says the cardiovascular clinic, does this clinic do heart surgery? No, no. We are a non-invasive cardiovascular clinic. One of the things that Dr. Batson and Batson and Associates and integrative practitioners try to do is not to do surgery on you. Our objective is not to do surgery on you. If surgery was done on you before, you may have done triple bypass, you may have done stenting and that type of thing, and you want to improve your cardiovascular function, we could help you. Because all stents eventually block back up or collapse or get blocked up. So usually when you do stents, they don't last. When you have cardiovascular problems, apart from doing stents and doing triple bypass surgery, you need to change your lifestyle, because you're going to end up in the same situation again. So that doesn't make any sense, right? So the integrative, operative word in front of there is integrative. Integrative clinic is a clinic that integrates Western medicine with natural and integrative medicine. So it now means that we can do echocardiograms on you, we can do ECGs on you. So you have additional information together with your blood analysis and your magnetic resonance analysis. And I don't make joke with those. When you come to the clinic, you have to do the good thing about it, because the clinic is integrative. Some of the things that you do, you'll be able to get back insurance for it, right? So it have a plus there. So that is the integrative clinics. So if you are a cardiovascular patient and you want to improve blood circulation, you want to improve your ejection fraction, you want to improve your blood cholesterol, you want to improve your triglycerides levels, that is the purpose of the integrative cardiovascular clinic. The integrative diabetic clinic is for diabetics who want to lessen the amount of insulin that they take. You want to improve your eyesight. We're going to have the advertisements for those done very soon. You want to improve your eyesight. You want to improve your blood circulation. You want to decrease your issues with neuropathy and nerve damage. That is the purpose of those clinics. You all get me? Sunshine Ray says, so if someone has a blockage, how do you treat it? If you have a blockage, then we treat it. There are things in integrative medicine that could clear arteries. You think the only way to clear arteries is for a doctor to open you and go and do a triple bypass? That is not the only way. There are a number of things, but we have to assess you. So if it is, for example, the only way to know if you have a blockage or have some kind of blockage conclusively is if it is you do, what do you call it again, boy? If you do an angiogram. The angiogram is where they put you to sleep and they take a dye. So you have different you have MRIs with contrast and non-contrast. When you do angiograms, they use contrast. They have to use a dye. So when the dye shows up now, when they look at it, they'll be able to see how much arteries are blocked. They'll be able to look at your proximal artery. They'll be able to look at your the other major arteries in the body, which I can't come to my mind right now. That is how you are actually able to determine. And then subsequent to the treatment that we give you, then you could go back and do the angiogram. There are persons who came to us with angiograms. We worked on them. They went back, they do the angiogram, and they had no blockage again. That is very possible. Very, very possible. Good? So you're listening to, or you have been listening rather, to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. A blessed good night to Rihanna Francis. So our program, or this program is almost finished. We just have a minute again. We did cover a number of questions outside of what we're treating as regards to hormonal disruption in women and women who have issues associated with hormonal imbalance and whatnot. Okay, keep in mind those integrative clinics rather. We have the integrated cardiovascular clinic, the integrative diabetic clinic, and the integrative musculoskeletal clinic. Good. If it is we working on someone in our clinic and you need surgery, then we will refer you to any one of the cardiologists that we would have worked with. You have doctor for certain things. But the objective in the integrative cardiovascular clinic and those integrative clinics is so that you do not have to do surgery again, or to prevent you from reaching the stage where you are so terrible that it becomes fatal. You see, people just think surgery don't fix everything. You know? Excuse me. And there are some people who don't realize that surgery cannot fix everything. So don't feel you could go and eat bad, your triglycerides high, and you have about 10 block arteries inside of there. Which, of course, I'm just being facetious. But you have a lot of block arteries in there and figure you just go and lie down on a table, they open you and they fix your back and you go back to nonsense again. No, it don't work so. It don't work so. I thought people just do that, but it is die. That is what you need to do. So make those appointments. You have the telephone numbers there. The WhatsApp is 314-9975. Again, that WhatsApp is 314-9975. A pleasant good night, Donna Howell. A pleasant good night, Mr. Clifton Henry. Miss Betty Phillips said, what causes bitterness in the mouth on mornings? Ask for a relative. It depends. I mean, sometimes some people don't drink sufficient water. It could be an indication of some sort of diabetic or early diabetic situation, or it happens to most diabetics. It could be a sign of improper digestion as well, a lot of flatulence, those type of things. Miss Eastlyn Haynes says, do you deal with seizures? My niece faints without warning. Doctor can't say the reason. Yes, we have helped numerous persons with seizures. Anybody who has seizures is an issue with the central nervous system. The synaptic response, they have serious problems with synaptic response. They also have serious problems with brain chemical imbalances. So things like the neurotransmitters, epinephrine, neoepinephrine, serotonin, melatonin, those things, out of whack. What they can do is if they did scans, MRIs, CT scans, then we will be able to help them with those situations. Okay, guys? So that brings our program to an end this evening. As usual, it's been a pleasure speaking to you guys. Keep in mind those telephone numbers. Keep in mind we are live, or we were live on all, or we are live, sorry, on all of our social media platforms. Well, two primarily. We are live on Facebook. On Facebook, we are Batson and Associates Ltd. On YouTube, we are Batson and Associates Trinidad. You're very welcome, Rochelle Parsons Matthews. And you also for yourself, when I ask the question, let me say thank you very much to the client, because I asked the questions for the simple fact of finding out, you know, and she said she got so much results, but, you know, she was unable to come for her revisit, but she got a lot of results. And that's the general consensus of all of our clients. So as I said, if you're really serious, you're serious, let us come, get your appointments, come do that 3-for-1. That 4-for-1 special is an excellent special. You get your blood analysis, your live blood, your dry blood, your magnetic resonance analysis, your consultation, and your food detox. You cannot beat that. You cannot beat that. Miss Marsha Joseph said, good night, doc. I have been sick since 29th of August. 3 blood tests shows that my white blood cells are 15.5. They placed me on 3 different antibiotics. Lord, and yet the white blood cells remain high. What can I do? You need to come and make an appointment, my dear. Are you in Trinidad? Because you see, that is a serious case. That is consultation. Consultation, blood analysis, scan, or bring the tests that you have, and we will be able to help you. But definitely, that is a serious situation. Ms. Eastlyn Hayes says, thank you. She has an appointment to see you next week in the Shagona's office. Excellent. Nicole Marad says, good night, Dr. Batson. What can I use for circulation in my legs? The balanced circulation. Okay, so you are in Trinidad. Yeah, you need to make an appointment, my dear. Things those serious, appointment. Because those antibiotics that you got there is serious antibiotics. You can't continue doing that. You're gonna end up in serious problems. Serious problems. So the telephone number again, 314-9975. You could send out a WhatsApp for that. We have a lot of clinics coming up. We have a lot of open clinics. You can come, have your blood analysis done, have your magnetic resonance analysis done, and then whatever other tests you have. So when I do your review, we can dot your I's and cross your T's and get you to the point where you start to get results and you start to get improvement. Comprende, my friends? Ms. Nicole Maharaj, as regards to circulation in your legs, the balanced circulation is a really good product. Santulan is also a really good product. The Alkagen water as well is also a really good product. If you have problems with circulation in your legs, is it that you're telling me that you're a diabetic and you are hypertensive as well, Ms. Maharaj or Maharaj? Make sure I'm pronouncing your surname properly. If you could answer me very quickly with that before I go so I could give you an answer. Keep in mind, again, those dates, St. James, open clinic day every Friday and Saturday in St. James, so check that out. The telephone number, again, you can use 222-8261. That's 222-8261, as well as 314-9975. Okay, no, you're borderline diabetic. What about high blood pressure? Talk to me. So you're borderline diabetic alone, or are you hypertensive as well? Just answer me quickly. No, it's up and down. What I would suggest for you, the circulation, you're not hypertensive, but you said it's up and down. Okay. Balanced circulation, the Santulan, but I would strongly suggest you do a consultation. Because if you tell me you're borderline, I don't know. The person must be telling you borderline diabetic. And I don't know. If you would have had to do a A1C to see it, or is it that you're telling me that they told you if you're borderline diabetic, it means you're pre-diabetic. If your blood pressure is up and down, it means you have a serious problems with poor circulation. And if you have poor circulation to the point where you have veins, where you have varicose veins, or you're in the US, okay, well, that's no problem. As I said, we can help anybody anywhere in the world. We could do a consultation for you, and we could make necessary recommendations where you would be able to get things right in the United States there to help you. All right, Ms. Maharaj. But with things like that, we need to dot our I's and cross our T's. All right, my dear? So, guys, it was a pleasure speaking to you. I have to take my leave now, right? Remember, those telephone numbers and locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. Those of you with regards to the consultation, just send in the 1-868-314-9975 number that you live ABC. This is your telephone number, and you are requesting to have an online consultation with Batson and Associates. The consultant will do all the base work, and then I will come in and finish it off for you guys. I put in the icing on the cake. But you have to let us know so that we could set the appointments and schedule you. We have a lot of clients. So we have to ensure that we schedule you properly so that you get the service, the efficiency, the effectiveness, and most importantly, we get you the results that you're looking for. I don't know, Ms. Maraj, if you saw on the live what that young lady said about what she started to use with the Santulan and that type of thing. We will get results for you. The only people who don't get better at Batson Associates is hardened people. That's the only people. Once you follow the instructions, you get results. Okay, guys, you're very welcome, Ms. Maharaj. As we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. Our next live on Thursday, I think we have to be shifting some things because I know how my schedule runs. So you guys will look out. Remember to like us, add us, share us. You all know the slang, as they say. And, you know, share the live and help somebody else who needs help. Remember, if you have problems sleep, or you know anybody who having problems sleeping, tell them about Batson and Associates. You have headaches? You have headaches for years? You always have headaches? Batson and Associates. Again, always a pleasure. Take care of yourself. God bless. And remember, as I said before, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless. Enjoy the rest of your night. Be safe tomorrow, please, God. Take care of yourself. Bye.